Hello students, welcome to Distinction Learning Platform, and in this video we are talking about hypertension. Okay, so before we begin this lesson, make sure that you comment in the comment section as well as you like the video, and there is a link that will take you to the website where you will find educational videos. You find also other courses. Make sure that you click on that link in the comment section. Okay, now in this video, let us try to talk about hypertension. So what we'll do is, we'll talk about hypertension, the risk factors associated with hypertension, the classification of hypertension, which include primary hypertension, secondary hypertension, and according to ACC, AHA classification. Then we'll finish up with complication as well as the treatment of hypertension. Let us begin. So what is this hypertension? Hypertension, basically, it has the simplest definition. Basically, it's just the elevation in blood pressure. Okay? What is hypertension? Hypertension is the medical condition characterized by abnormal elevation of blood pressure outside the normal range. Okay, we'll talk about the normal range of blood pressure, okay, if you start talking about this one. But just not to say hypertension basically is just the elevation of blood pressure, and it's a chronic medical condition. Okay, now this hypertension, since we're talking about the blood pressure, let us talk about the blood pressure, because knowing the formula of blood pressure, it is crucial when it comes to talking about the pathophysiology of this hypertension. Okay, so let us look at the formula for blood pressure. So blood pressure, basically, we're going to have cardiac output multiplied by SVR, which is systemic vascular resistance. Okay, so that is the basic formula of blood pressure. Okay, now what does that mean? It means that anything that's going to make sure that the cardiac output is going up or increases, then it's going to elevate the blood pressure as well. Or anything that's going to increase the systemic vascular resistance, it will make sure that also the blood pressure is elevated. We need to take note on that. Okay, so now if we go further talking about the cardiac output, because we also need to understand the formula of cardiac output. Cardiac output also depends on various factors, okay? Like, it's going to depend on heart rate, as well as it's going to depend on stroke volume. So let's just say SV, stroke volume, okay? Again, anything is going to make sure that it elevate the heart rate, basically it's going to elevate the cardiac output, or anything that's going to promote the elevation of stroke volume, and those things or those factors are going to elevate the cardiac output. And if you increase the cardiac output, what do you think? The blood pressure is going to be elevated. Why is it like that? Because blood pressure and cardiac output, they are directly proportional to one another, which simply means that if you elevate the cardiac output, also you are elevating the blood pressure. Then same applies to SV. The relationship between systemic vascular resistance and blood pressure, they are directly proportional to one another. Simply means that the systemic vascular resistance, if you increase it, also the blood pressure is going to be increased. The last important concept is talking about the systemic vascular resistance. Systemic vascular resistance depends on what? Vascular tone. Okay, vascular tone. What does it mean? Okay, if you look at the vascular tone or the blood vessels, let me just write as a good example. If this is a blood vessel here, okay, so SVR is going to depend on the diameter of this what can I say, of this blood vessel. Okay, if you try to make sure that you squeeze this blood vessel and it becomes very small, it simply means that you are going to elevate the systemic vascular resistance. Then what do I mean? I mean to say if you try to vasoconstrict these blood vessels, you are increasing the systemic vascular resistance. If you increase the systemic vascular resistance because you are constricting the blood vessels, meaning that the blood pressure is going to be elevated. Okay, so that's what I simply mean. Okay, so that is the basic introduction to hypertension. And the other important question that you can ask is that why is it important to know about this disease? Because this hypertensive disease or hypertension can lead to various complications that are very, very dangerous. That we'll talk about there. But one of the most important complications is one of the risk factors causing stroke. Okay, and maybe the transient ischemic attack as well. Then apart from that, also maybe it's one of the cause of chronic kidney disease. All those things, they are the result of hypertension. No wonder it's very important to study about it, because it causes chronic fatal conditions. Okay, now since we've understood about the hypertension, okay, now let's go to the risk factors, things that can promote someone to have hypertension. Okay, what are those risk factors? Now, risk factors, again, they are further categorized into two main components. The first one is what? The first one is modifiable risk factors, and the other one is non-modifiable risk factors. So let us start with the modifiable risk factors. Modifiable. Okay, let's just say RF, risk factors. So modifiable risk factors, it means that those risk factors that you can change, you can modify. Basically, you can change them. Okay, if you can do something. But for non-modifiable risk factors, you can't do anything. They are just there. Okay, you can't change them. No wonder they are very, very dangerous. Okay, because you can't change them. So now let us start talking about these modifiable risk factors. Okay, what is the first modifiable risk factor that we know? Modifiable risk factor, the first one is smoking. Okay, smoking can promote hypertension. If someone smokes also, then alcohol. Takes alcohol. Okay, alcohol is one of the risk factors as well, modifiable risk factor. Reason why it's modifiable, because you are able to stop drinking alcohol, you're able to stop smoking. Okay, so because those are modifiable risk factors, you're able to change them. What's the next thing apart from that? Maybe someone with let's just say diabetes mellitus. Okay, diabetes mellitus is one of the modifiable risk factors. Okay. Okay, then apart from diabetes, maybe someone with okay, so apart from diabetes mellitus, again, maybe someone with the chronic kidney disease. Okay, CKD. Okay, chronic kidney disease is one of the modifiable risk factors of what? Hypertension. Then another one, let's just put the last one, obesity. Okay, obesity is one of the modifiable risk factors. There are a lot of modifiable risk factors that we can know, but simply let us know about smoking, alcohol, diabetes mellitus, CKD, chronic kidney disease, as well as obesity. These are the important modifiable risk factors. And also, maybe if you want to add on, you can add on excessive intake of salts. Okay, that is also a modifiable risk factor. Now we can go to non-modifiable risk factors. Modifiable risk factors. So non-modifiable risk factors are the factors that we can change. Okay, the factors that we can change now, I'll just pick like age. So we can just say increasing in age. Increasing age. Okay, one of the non-modifiable risk factors, because you can't change the age of someone. Okay, so increasing age, maybe it has been shown that people starting from 25 years and going up, they are at increased risk of developing hypertension. Okay. What else? Sex, which is male sex. Okay, male sex is also one of the risk factor. As well as now you can put family history. So family history of hypertension. Okay, and the last one is genetic predisposition. Genetic predisposition. Disposition. Okay, so genetic predisposition, those are the factors that you can change. So again, just to summarize whatever we've talked about, we're talking about the risk factors that can promote hypertension. And these risk factors, they can be further categorized into what? Modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are the what? Are the factors that you can change, such as smoking, alcohol, diabetes mellitus, CKD, obesity. These factors, you can change them. Now, there are some other factors that you can change, and we call them non-modifiable risk factor of what? Hypertension. And these include increasing age, and I said starting from 25 going up, those are that's the population at increased risk of developing hypertension. Then again, if you talk about the sex, that should be male sex. They are at increased risk of developing hypertension. And the family history of hypertension, one of the non-modifiable risk factor. Last, and genetic predisposition of what? Hypertension. So these are the risk factors that you can take note of. Now, since we know the risk factors of hypertension, now this hypertension that we're talking about, how can you classify it? So we can classify hypertension using different ways, but this is the common way that they classify hypertension according to the what? Etiology. So we're classifying hypertension according to the etiology, but it can be classified according to agents. It can be classified according to maybe severity, and maybe according to what? Maybe if you are given medication, if it is refractory or non-refractory, like that, or resistant. Okay, so we can classify in simpler terms. What we're saying is hypertension can be classified in many ways, but this one is the simplest way, or the common way that they classify hypertension. Okay, so now we'll start with the first one, primary hypertension. So primary hypertension is what? So primary hypertension is a type of hypertension where most cases are what? Are idiopathic. Okay, where the cause of that hypertension we don't know, and it's a common type of hypertension. Okay, so what are we simply saying? Okay, so what we're simply saying about this disorder, we're simply saying that it's a common type of hypertension in 90 to 95% of cases. That's what we are saying. And the most of the causes of this type of hypertension are what? Idiopathic. Okay, so we are saying most cases are what? Idiopathic. Idiopathic, what does it mean? It means that you don't know the cause. Okay, you can't identify the cause of that hypertension. Okay, but for this primary hypertension, since this is more like you don't know the cause, but they refer this hypertension to the risk factor. Okay, so primary hypertension, basically they have linked the risk factors. These are the ones that are going to be causing primary hypertension, or these are the causative agents like predisposing someone to have primary hypertension. And primary hypertension is also called essential hypertension. So if you just hear the word essential hypertension, basically they just mean it is primary hypertension, which in most cases, about 90 to 95%, we can't find the cause of hypertension. No wonder we just use risk factors under primary hypertension. So you need to take note of that, okay? Now, we go to another one, which is secondary hypertension. Okay, now secondary, if you say primary here we're saying we don't know. Now secondary, the hypertension that we are having is because of an identifiable cause. We know the cause of that hypertension. Okay, the one that's called secondary. So we're saying now, for secondary hypertension, yes, we know the cause. So here we're saying not common, but we're going to say it's not common, but in like the percentage for this one is ranges from 5 to 10%. Okay, so the percentage of this secondary hypertension is about what, 5 to 10% of what cases, and we're saying here the cause is known. The one that is called secondary hypertension. Okay, it's because of something. That's why someone is having that hypertension or elevation of blood pressure. Okay, now since we know the cause of secondary hypertension, that simply means that we need to talk about those causes or things that can cause the elevation of blood pressure, since we know the cause. Okay, now since there are a lot of causes of this secondary hypertension, basically we're going to use a certain mnemonic so that it can help us to remember if we are dealing with the secondary hypertension causes. Okay, so we can simply remember this secondary hypertension by simply this mnemonic renal. Okay, we can use this mnemonic renals. Okay, renals. So we can simply use this mnemonic renals to remember the causes of what is secondary hypertension. So what we'll do is, if I talk about the etiology of that secondary hypertension, basically we'll talk about also the pathophysiology of the same cause. Okay, so that's how we're going to be learning. Okay, so let's start with the first letter, which is R. R. So let us use red. So we are saying R. Okay, R stands for what? Now renal. That's the same way. So we are going to say renal disease. Okay, basically anything that's going to affect the kidneys, okay, those can result in what? Hypertension. Okay, so now what are those renal disease, the renal causes or renal diseases? What are those? So we need to know the examples of those renal diseases that can cause hypertension. Simply, they are just very simple to remember. The first one is what? CKD. Okay, chronic kidney disease, one of the causes of hypertension. Renal artery stenosis. I'll be just using the initials. So renal artery stenosis, one of the cause of what? The secondary hypertension. And the other one is the last one, which is polycystic kidney disease. Okay, PKD. So again, CKD, chronic kidney disease, renal artery stenosis, polycystic kidney disease. These are the renal causes of what? Secondary hypertension. Now remember what I said. I said to say, if I talk about the cause or the etiology, I need to talk about the pathophysiology of those causes. Now, so since these are the renal causes, as you can see this diagram here, these renal causes, they are affecting these kidneys. Okay, these are the kidneys that have been affected. Now what happens is like this. If the kidneys are affected, basically remember the GFR, glomerular filtration rate, is also going to be affected. So you're going to have, in case of maybe CKD, you're going to have little GFR. So small amount of GFR in the renal system basically is going to activate the RAS system. So what we simply mean here, because of these renal diseases, CKD, RAS, and PKD, they are going to activate what? The RAS system. So these in turn, they just activate the RAS system. That in turn elevate the blood pressure. Okay, so just know that if someone is having the renal disease such as this, they're going to activate the RAS system. Remember the RAS system from basic physiology, we said renin is going to be produced by the kidneys, okay, and that renin is produced due to maybe decreasing GFR. Then that renin, if it is being produced, it is going to do what? It's going to convert angiotensinogen into angiotensin 1, and angiotensin 1 will be converted into angiotensin 2 by angiotensin converting enzyme. Then angiotensin 2 is the one now that's going to help in the elevation of what? Blood pressure, by simply maybe increasing the systemic vascular resistance, as well as by help in the production of what? Aldosterone, that in turn elevate the blood pressure by promoting sodium and water reabsorption. So you need to remember that pathophysiology from the basic physiology there. Okay, so in turn, so just to summarize everything, we're saying renal disease, basically they activate the RAS system, that in turn now increase the blood pressure, and increasing blood pressure is what we call hypertension, which is simple to understand. Okay, so that's about the renal disease. Now let's go to this one, E. So let's go to E. What is E? E is endocrine. Okay, E is endocrine. Okay, endocrine diseases, okay, or disorders, whatever. So endocrine diseases or disorders. So we've got two. As you can see, we've got two important glands here. There's this one. This one is what we call adrenal gland. Okay. So these are called adrenal gland, and there are some problems that can go wrong with a adrenal gland. Okay. So we can start with the first condition, which we call Cushing syndrome. So for adrenal gland, we've got the first one, which is Cushing syndrome. Then let me just say S. Cushing syndrome. Basically, Cushing syndrome is characterized by what? Increase in production of cortisol. So here we're going to say increase in production of what? Cortisol. So cortisol. Increase in production of what? Cortisol. That's what we call Cushing syndrome. Okay? Cortisol. Another one for adrenal glands. Okay? We have another one which we call pheochromocytoma. Pheochromocytoma. So pheochromocytoma basically is more like a tumor that is being developed in the adrenal gland, and that tumor is capable of producing norepinephrine and epinephrine. Okay, so simply means that pheochromocytoma is characterized by what? Just the production of what? Norepinephrine and epinephrine, like that. Pheochromocytoma. Okay, so that's about the adrenal gland. So Cushing syndrome and pheochromocytoma, those are the endocrine causes or adrenal gland causes of what? Hyper increase in blood pressure. Okay, so remember that these two, if you look at here, we said renal disease increased RAS, but these two, they have the direct ability to act on the blood vessels, thereby increasing the systemic vascular resistance. If you remember, if you increase the systemic vascular resistance, it's going to increase the blood pressure. Okay, so here what do we simply mean? So what we're saying here is these are going to increase the what? Increase the systemic vascular resistance, thereby increasing the what? The blood pressure. So that's what we simply mean. Okay, and the last one is this one. These are thyroid glands. So thyroid glands now, here thyroid glands, Let us use black for thyroid so that it can be clear. So thyroid glands here, basically, these ones we are going to have maybe two important scenarios. Okay, so two important scenarios. So remember that the thyroid gland produces thyroxine hormone T3 and T4. Okay, so now there are two cases here. So if you are producing or abnormal production of thyroxine hormone, then that's what we call hyperthyroidism. Okay, so hyperthyroidism and hypothyroidism. So what we simply mean is that this one increasing the production of T3 and T4, or decreasing the production of what? T3, T4, they both cause elevation of blood pressure. Okay, but the question is how? So this one, the hyperthyroidism, basically it does like this. It's going to increase the systemic vascular resistance. I mean, the T3 and T4, they're going to increase the cardiac output, thereby increasing the blood pressure. That's how they do this. And for this one, T3 and T4, they're going to increase what? The systemic vascular resistance, resulting in what? Blood pressure. So again, what I simply mean is that increasing T3 plus T4, this one will result in what? Increase in what? Cardiac output. Okay? Cardiac output. Reason being because thyroxine hormone, they act on the heart muscles, thereby promoting the contractility of those heart muscles, as well as the increase in the heart rate. Those two important factors, they are going to increase the what? The cardiac output. If you increase the cardiac output, you are increasing the blood pressure. So thereby increasing the blood pressure. So that's what I simply mean. But if you look at this one is strange. The T3, T4, the hypothyroidism. Hypothyroidism, it has also another mechanism of pathophysiology. Instead of increasing the cardiac output, this one is going to increase the systemic vascular resistance. Okay, systemic vascular resistance. So this one is going to increase the systemic vascular resistance, resulting in what? Increasing blood pressure. If you remember, the effect of thyroxine hormone on the blood vessels is to vasodilate. Now remember that if you don't have these, you don't have these thyroid hormone in hypothyroidism, basically those thyroid hormone, they are going to promote now vasoconstriction. Reason being because they are not there to vasodilate the blood vessels in hypothyroidism. Okay, so that's how they cause the increase in blood pressure. Okay, so now N. So let's go to N. Okay, N. So N, this one I'm just going to write it. The N, I'll write it here. Okay, N stands for neurological disorder. Oh my God. So N stands for neurological diseases. Okay, so neurological diseases, but this one, anything that's going to increase the intracranial pressure. Okay, any disorder that is affecting the brain and increasing the intracranial pressure result in what? Result in blood pressure. Okay, so we're saying anything that's going to increase the what? The intracranial pressure, ICP. So anything in any neurological disorder or a disease that is affecting the brain that's going to increase the intracranial pressure can result in increase in what? Blood pressure. Okay, so now what are those neurological diseases that can result in increase in intracranial pressure? There are a lot. There are a lot of diseases. Like the first important one is meningitis, neurological like carcinomas or tumors. Okay, like also we've got maybe someone with the hydrocephalus, like that. All those disorders, they're going to increase the intracranial pressure. But the moment we increase the intracranial pressure, there will be what? Now this one, the increase in blood pressure, which is hypertension. Okay, then the other important aspect that they can actually test you during an examination is this one, the Cushing triad. Okay, so Cushing triad, they can ask you on this one, Cushing triad. Okay, so Cushing triad is going to have three important things. It's going to have elevated blood pressure. Okay, it's going to have bradycardia. Okay, and it's going to have irregular respiration. Okay, so this is what we call Cushing triad. Okay, so you need to be aware of the Cushing triad. So Cushing triad, basically, it has elevated blood pressure, it has bradycardia, it has also irregular respiration. You need to understand that, but that's what we call Cushing triad, and mostly it's going to be what it's going to be like assessed during an exam. If someone is showing neurological disorder, basically they are going to show Cushing triad. Okay, make sure that you know about that. Now the last, which is this one, we go to A. Okay, so I'll come back to this diagram. So let's go to A. What is A? Okay, so A stands for aortic. A stands for aortic coarctation. Coarctation of aorta, or aortic coarctation. So that is the A. That's what it means. So coarctation of aorta, basically, if you remember the normal anatomy of the aorta, okay. Now coarctation aorta happens on the cave of the aorta, okay. So where the aorta caves like that, and there is decrease in the diameter of the what aorta there, okay. So what I simply means that if you remember this cave of the aorta like that, okay, the one that's going to, the one that is coming from the ascending aorta, then there's that cave, and then going to what descending aorta like that, or abdominal aorta. So but a coarctation of aorta, basically there's a decrease in the diameter of this curve, resulting in something like this. Okay, so if you now look at what's going to be happening here, if the blood coming from the heart going like that, there will be a very, very narrow lumen that is there, increasing the pressure in the aorta there. If you increase the pressure, basically, what are you talking about? We're talking about now increasing the what? Blood pressure, because of the narrow lumen. Remember that narrow lumen affect the what? Systemic vascular resistance. So if you decrease the lumen of this blood vessel, what do you think is going to happen? You're going to increase the systemic vascular resistance, resulting in increasing the blood pressure. Okay, so that's how coarctation of aorta causes what? Hypertension. Okay, now let's talk about this diagram now. The last one, which is the L. So L stands for lifestyle. Lifestyle and pregnancy. Okay, so lifestyle and pregnancy, basically we're just talking about someone who is what? Pregnant. Okay, someone who is pregnant, they are at increased risk of developing hypertension. But how? There is a condition in pregnant women, according to Hobbs and Guy, there is a condition which we call preeclampsia. So there is a condition which we call preeclampsia. So preeclampsia basically starts the elevation of blood pressure for the first time during pregnancy, with associated with what? Proteinuria. Okay, someone is removing proteins from the kidneys, as well as there is elevation of blood pressure, and it happens in the what? Third trimester. You need to understand about that, and that's what we call preeclampsia. And it has been shown that preeclampsia, the pathophysiology of preeclampsia is that if you look at the fetus there, the fetus is not receiving enough oxygen, or there is placental insufficient. If there is placental insufficient or the fetus is not receiving enough blood, the placenta will react by producing massive cytokines that will go to the blood vessels and vasoconstricting the blood vessels. If you vasoconstrict the blood vessels, you are increasing the systemic vascular resistance and increasing the blood pressure. Okay, so that's how preeclampsia can cause hypertension, because of there is what placental insufficiency, or the fetus is not receiving adequate oxygen, there. Okay, and preeclampsia, it has maybe another terminology that they use, eclampsia. So eclampsia, basically someone is having elevated blood pressure during pregnancy and they are having seizures. So seizures, basically it is eclampsia. Okay, so someone with seizures, basically if you say seizure or eclampsia, it's just the same thing. So seizure or eclampsia. Okay, seizure or eclampsia, that's one and the same thing. Okay, so that is L, lifestyle and the pregnancy. Okay, now the last one is S. The last one is S. Okay, so S stands for what? Substance abuse. Okay, substance abuse, basically we're just talking about abusing drugs. Okay, you are abusing drugs like amphetamines, you are abusing drugs like NSAIDs. So those drugs, they have direct effect to the blood vessels, and that increases the systemic vascular resistance, increasing now the blood pressure. So for S, it means substance abuse. Those people that misuse the drugs such as what? Amphetamines, the NSAIDs, okay, corticosteroids, all those drugs, they are going to make sure that elevates the blood pressure, okay, causing this hypertension that we are talking about. Okay, and the last S, there are two S. So this is substance abuse, and the other S is sleep apnea. Sleep apnea. Okay, so the other S stands for what? Sleep apnea. So sleep apnea, basically it means someone who is not having adequate sleep. Basically that will result in what? Lack of oxygen to body tissues. If there is lack of oxygen to body tissues because someone is not sleeping well, and the lack of oxygen causes what? Elevation of blood pressure, or causes vasoconstriction of different blood vessels, thereby increasing the blood pressure. Again, the last S stands for what? Sleep apnea. Sleep apnea means that the way you sleep and you are having inadequate oxygenation to different tissues, and since you don't have a lot of oxygen in the body or to the body tissues, and that can stimulate the vasoconstriction. If you vasoconstrict now, basically you are going to elevate the blood pressure. Okay, and that's a lot. So now those are the etiology and the pathophysiology of what? Secondary hypertension. Make sure that you take note of everything that I was talking about. Now next, let's talk about now the last important part, this classification. Okay, according to ACC and the AHA classification of what? Hypertension. Remember that the other classification that we are talking about, it was according to etiology. Now here we are talking about according to American College Cardiology. So this classification, basically we are going to be putting numbers here so that you understand. So we are going to have the stage SB, systolic blood pressure, and the DBP, that is the diastolic blood pressure. Okay, so if you look at the normal blood pressure, basically for systolic blood pressure it has to be less than, okay, it has to be less than 120, and for diastolic blood pressure it has to be now less than 80. Okay, so this normal range for what? Blood pressure. That's a normal range, less than 120 and less than 80, normal range. Now, in pre-hypertensive patients, basically this one is going to change. For systolic blood pressure is going to change. It will be between 120 to 129. Okay, 120 to 129, and the diastolic blood pressure will just remain the same, which is less than 80 millimeter of mercury. Okay, for stage 1 now hypertension, someone with stage 1 hypertension, they are going to have now different systolic blood pressure. So here they are going to have 130 to 139. So 130 to 139, that is stage 1. But here for diastolic blood pressure, now it will start increasing from 80 to 89. Okay, that is now stage 1. 130 to 139, as well as now systolic, as well as the diastolic, which is 80 to 89 millimeter of mercury. Okay, we go to stage 2. Stage 2, basically now we are going to have greater than 140. So we're going to have now greater than 140. That is stage 2. And here for now diastolic blood pressure, it has to be greater than now 90. Okay, greater than 90 and greater than 140. Then we're going to consider that patient as in stage 2 type of what? Hypertension. Okay. Now let's talk about this hypertension agents and hypertension emergence. Okay, so these two, they fall under what we call, so these last two, the hypertension agents and hypertension emergence, they fall under what we call hypertensive crisis. Okay, so you need to pay attention on that. Okay, so hypertension crisis, basically you are going to have the two important types: hypertensive agents and hypertensive emergence. So if you look at the numbers here, the numbers for hypertensive crisis or hypertensive agents, they are just the same. Here for systolic blood pressure, you're going to have greater than 180, which is a load. Okay, for diastolic blood pressure, it has to be greater than 120. Same applies here for emergence as well, 180. Also here 120, like that. Okay, same numbers, but the question that you can ask is that what can differentiate the two? What can differentiate the two? Since they are having the agents, you see, the systolic blood pressure should be greater than 180, the diastolic blood pressure should be greater than 120. Same applies to emergence. Now the difference is this one. For hypertensive agents, there is no target organ damage. Okay, so we are saying for agents, you are not going to see target organ damage. So there is no. Okay, for hypertensive agents, there is no target organ damage. That's what differentiates. Okay, there is no acute renal failure, there is no CKD, there is no stroke, there is no myocardial infarction, there are no target organ damage. But for hypertensive emergence, now there are what? Target organ damage. You are able to see now renal failure, you are able to see heart failure, you are able to see stroke. Okay, all those complications, they are there in hypertensive emergency. That's what differentiates the two. Okay, and this is what the other classification according to ACC and the AHA. That is the classification. It is based on what? The systolic blood pressure as well as the diastolic blood pressure. Okay, so now let us now try to finish up whatever we're talking about. Okay, so now what are the complications of hypertension? So complications of hypertension, let us simplify them. Okay, so let us use black. So the complication now could be based on a system that's going to be affected because of the maybe the shock that they are having, whatever. But we are just going to be using what the system by system. The first one, we are just going to pick one from each system. Like this hypertensive is so severe and we are having target organ damage. Then if it affects the brain, then someone is going to have what we call stroke or transient ischemic attack, TCA. Transient ischemic attack, TIA. Okay, so you can have stroke or TIA, transient ischemic attack. Okay, then we can have another one. So this is from the brain. Now we can go to maybe the heart, the cardiovascular system. We can have heart failure. We can have MI, myocardial infarction. Okay, we can have a lot of what complication or cardiovascular complication. Okay, we can go to another one, the renal system. Basically, we are going to have the renal failure. Okay, respiratory system, we can have respiratory distress syndrome, RDS. We can have this respiratory distress syndrome. So there are a lot of complications that you can have, but you can just end from there. The under respiratory system, which is respiratory distress syndrome. So we can have stroke, heart failure, myocardial infarction, renal failure. You can have RDS, a lot of complications that you can have. Okay. Now, since we know everything about the hypertension, now let us complete by now talking about the treatment modality. So these are now things that you can do if someone is having hypertension, either essential hypertension or secondary hypertension. So there are actually two important clinical modalities for treatment. Okay, so treatment modalities, they can be based on lifestyle, modification, okay, as well as pharmacological. So pharmacological and lifestyle modification. So those are the things that you can consider someone having hypertension. Okay. So for lifestyle modification, if you come here, we said there are some things that you can change for modifiable risk factors for hypertension. So meaning that you can try by all means to change, like smoking, you stop smoking, you stop alcohol, the way you take nutrients from the body in the body, okay, and you need to be restricting some maybe salts like that, okay, and make sure that you treat CKD like that, okay. So you need to make sure that you try to modify those risk factors, because remember that essential hypertension is caused by what? These modifiable what? These factors, okay? So you need to try to modify these factors so that now, by all means, you can eradicate that hypertension that you are having. So that's the first important thing that you need to do, lifestyle modification. Then pharmacological management, you can give what we call antihypertensive drugs. Okay, for this one, you can give what we call antihypertensive agents or drugs, hypertensive drugs. And hypertensive drugs, so good example of these hypertensive drugs, we have a lot of them. We can be giving these people the ACE inhibitors. Okay, let's just say I. So you can be giving ACE inhibitors and angiotensin converting enzyme inhibitors. Okay, this can help. You can also give them diuretics. Okay, diuretics helps as well. What else? So you can also give them ARBs. So ARBs is angiotensin receptor blocker. Okay, angiotensin receptor blocker, you can also give them that. Okay, there are a lot of drugs that you can give, as well as maybe you can give antihypertensive drugs, like maybe you can give labetalol. Okay, you can give those good examples of what sympathetic what and blockers, sympathetic blockers. Okay, so we can give also sympathetic blockers, like alpha blockers, beta blockers. We can give something like that. Okay, so sympathetic system blockers. So sympathetic blockers. So you can give beta blockers, alpha receptor blockers. Okay, all those things we can give them as well. Okay, and this is how you can go about it, hypertension. And this is where we end from. Make sure that you study more. All the best until next time.